Okay, good afternoon, everybody. Welcome to the County of San Diego. If you're here for anything else but a meeting of the Regional Task Force on Homelessness, you can leave right now, because that's what we're all about here this afternoon. And I'd like to welcome you all here. We're going to start, as we always do, with public comment for non-agenda items. I have 2 speaking requests in front of me, and we'll allow each of those speakers to speak to a maximum of 3 minutes. And in 3 minutes, I will kindly ask you to stop. No, I won't kindly ask you. I'll yell at you. So I'm going to start with Dennis Stein and then John Kitchen.
All right, I'll be very brief this time because last time I pushed the limit.
You were pushing your limits last time. Okay, go ahead.
So I've done a bunch of screenings of Tony the Movie across the county since the beginning of October, and they've gone really well. We've had great attendance, really good discussion with the audiences afterwards, and hopefully I'm telling the story a lot about what's going on here at the Regional Task Force. And there are upcoming screenings. There's one tonight at 700 Front Street at Monica Ball's building at 700 Front Street. And then we've got one at the Observatory where Chris Ward will be a guest speaker. I'm very excited about that one. 550-seat venue. So please spread the word about that if you have friends or family or colleagues who you'd like to come see one of these. And there are other screenings listed at tony-themovie.com, and you click on screenings. There's a whole list of them. Thank you so much.
Thank you, Dennis. And I don't think I mentioned last time, he does a great job with his camera. I'll give you a plug since you got in it less than 3 minutes. Okay, John?
Okay, I'm John Kitchen. I'm usually the only homeless person here, plus the only news media person here. I want to thank and compliment both the mayor and his organizations, including the Housing Commission and this group, for finally taking a stand for the first time ever to address some of the problems with all past approaches to deal with homelessness. The 26 in Pershing homeless tent camp is thus far a success, as well as the latest round of Housing Our Heroes and the expanded Dreams for Change Park in Your Car and Sleep in It. However, the new toilets are basically a scam, and we now have fewer showers than ever before, both a huge health threat. In addition, there's been more harassment of sidewalk homeless than ever before since the 1930s. Jails are being used to house homeless at a cost to the taxpayers of $1.5 million a day, enough to spend all $80 million of our HUD money for the year in just 53 days. So we will have spent more than all our HUD money just on jails by December 11th of this year. But let's continue with the diverse options. Have some real toilets and showers, and stop jailing the homeless who have committed no crime. No plan can be effective while the city continues to tear down 1,000 low-cost housing units a year, replacing them with only 300 to 500 units. There's never been successes before now, so there's nothing to compare with, but in general, there is way less to correct than usual. Thank you. You are making this happen.
Thank you, John. Under the time limit, too. Kudos to both of you. Okay, the next item is our consent calendar. There are 2 items that can be approved for the consent calendar, items number 3A and 3B. One is approval of the minutes of September 21st, and then there is a financial report in August. It's the financial statement, August of this year. If there is a wish to pull either one of those items, this is your chance to shout. If I don't hear any, I assume.
Chair, I believe that the Housing Commission was not recused last time, and they need to be. So I'll make sure that happens, but I didn't know if I needed to let you know.
Okay, you gotta let them know.
Well, they know. They told me.
Okay. Okay, the Housing Commission is recused. Okay. With that, do I have a motion for approving those 2 items, please?
So moved.
Motion over here, Karen. In a second. I have a motion and a second. There's no comment on this. All in favor signify by saying aye. Aye. Any opposed? Hearing none, we'll deem that's unanimously approved with the Housing Commission not participating, correct? Okay, Executive Officer and CEO updates. I guess I get to start. Privilege of the chair, Mr. Vice Chair. there is actually good news. There's a number of things happening there that are positive. The county officially approved the Housing Trust Fund with the $25 million. This was done on October 10th. You will see there'll be a notice for funding availability that will be coming out probably within 60 days before the end of the year, for sure. And I think that's going to get some action. Hopefully will stimulate some of the developments that maybe can be that bridge that will make something happen that otherwise might not. The other thing is that the first of the county's 11 properties, we're moving right along with those. If you recall, we looked at 11 different properties that are worth way more than the $25 million. And we are going to be turning those into housing. The first two of those that will be teed up, so to speak, because we're going through a pretty extensive analysis. The first two, one will be in downtown and one will be in Claremont. And I expect that early next year we'll have these on the streets. And you'll see some action in those areas. And then lastly, I would share with you you're going to have a report on Hep-A later in the meeting. I'll just tell you this past week, I was in Atlanta. Atlanta is the headquarters for the Centers for Disease Control and Prevention. We sometimes forget it's and prevention. And I can't say enough about the people there and the support that they're giving to San Diego. They have been on this from day one. I know there's some media out there who don't even know that we had issued notices on this a long time ago, even to them, and they've forgotten that they received them. But these guys were in early on, probably in March, Nick, that they were on top of this. What they do is so sophisticated, it's unbelievable in terms of, I went there among other, I've met with these people ironically 3 times in the last 3 weeks. I went to Washington, D.C. a few weeks ago. I was there on other business and decided, okay, got to check in. Had arranged to have a meeting with the Washington, D.C. people. They gave me a video conference also with the people in Atlanta. This is the only federal agency that's actually headquartered outside of Washington, D.C. It's headquartered in Atlanta. And so I met them by video the first time. Ironically, they were here the following week. The 2 principals were here for an infectious disease, international infectious disease conference. We met for the second time. We went over everything in detail. And I told them, by coincidence, I was going to be on other business in Atlanta the following week. And they invited me to come by and they wanted to show me exactly what they were doing. They have people dedicated to taking care of the San Diego things that come in, so they're done in the promptest way possible. And the technologies, okay, I'm an architect, I'm not a biochemist, and so I got to say some of this floated above me, although I did have a firm that specialized in laboratory design, so I recognize, but what they do in tearing apart the DNA and doing an incredible analysis, and then putting everything back together, and we get all these little markers. They know exactly what is going on. They know Hep-A 1B from Hep-A 12C, and they can tell you everything. They know if it's a San Diego marker, so to speak. And I've learned, this is maybe originated in the Middle East. I think when it migrated to come here, but they're tracking it, and it's obviously occurring elsewhere in the country now. But they're the ones that help us and facilitate vaccine in terms of us maintaining a supply here, which is getting difficult because of demands in other areas. So our communication with them is extremely important, but it's making a difference. And I will tell you, their answer is pretty simple. In the short term, vaccinate, 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 and then vaccinate the one you missed. That's the way you're going to see you're going to drive these numbers down. It's going to take a while. We don't know exactly. It's too soon to say, but at least the most recent statistics seem to be leveling off, maybe. And we're hopeful of that, but it's still going to take months to run its course. So I want to just share that with you. You'll hear more from the guy that really knows, Dr. T. and that'll be later in the meeting. So, Mr. Vice Chair, do you have anything you'd like to share with us?
I do, Mr. Chair. Thank you. So we have a number of high-level updates from the city. It was really an aggressive month, and a lot of, I think, groundbreaking opportunities had opened up. So happy to report out of a lot of activity from the city's efforts. We had a transitional camping area in the 20th and B operations yard. It actually fronts the 20th, 26th, and Pershing intersection within the Balboa Park, Golden Hill kind of interface that opened up. So we're looking at we did get about over 200 individuals. 40 of those are children, about 40 plus are women, and then a number of seniors and disabled and others with some of the most serious health and chronic health issues off of downtown streets and into a pipeline where they are receiving sanitation, general care, food services, appointments, transportation to appointments, and housing navigation. I think we've even gotten at least one that I know of, maybe a few more into other housing opportunities, thereby creating an opening and allowing somebody else to come in off of the streets. So it opened up very quickly, I think on October 9th, so that was just a little over a week ago, but already has shown really tremendous success in providing care for and security for those individuals who would otherwise be camping on the sidewalks. In addition, this past Monday, we opened up a safe parking zone. We know the work that Dreams for Change has been able to do in conjunction with Jewish Family Service and another church in the Golden Hill neighborhood. We were able to expand operations at JFS and offer an additional city-owned site in the Kearny Mesa neighborhood for another 40 individuals who would otherwise be sleeping in their cars on the streets to congregate and be able to provide more social services on site and help get them into the front door pipeline. It's rough, but it's definitely a way that we're able to at least get people into some systems and be able to do more in the interim while we wait for the next big opening, which is going to be our temporary bridge shelters, also known as the sprung structures. We originally were targeting those to open up sometime by the end of the year and then December 1st, and we really think we can get at least one open before Thanksgiving. We're receiving the materials, they're under construction right now, and tying this back to the transitional campground area that has met a little bit of resistance, but we've been able to answer questions and mitigate some questions throughout the Golden Hill neighborhood. We are committed to then closing down that campground, moving everybody into one of those structures, and then evaluating how it went and see whether or not this is a good temporary system to be able to replicate elsewhere. I continue to push the mayor and some of our city leadership on opportunities on the SDCCU/Qualcomm, former Qualcomm Stadium site, and a few other city-owned parcels out there for additional emergency temporary kinds of facilities that we can be able to employ in response to our Hepatitis-a crisis. The City Council on October 2nd did re-ratify a shelter crisis declaration, which tied in nicely with an assembly bill that was recently passed by the governor, Assembly Bill 932, which I had asked the City of San Diego sign on to be one of the 6 cities that would be allowed to have an expanded use of suspension of state and local building codes and ordinances where public safety and health can be guaranteed. We will be able to cut some red tape to try to get additional temporary or emergency related services for the homeless population up and running even faster. So the governor had a very carefully worded signing message that this should certainly be used in extraordinary and should really be reserved for very limited opportunity. We understand what he means by that because, of course, as California's officials, we are all committed to stay the course on housing first related principles and spending our money wisely while at the same time managing the effects around homelessness right in front of our face every day. So really appreciated all the legislative efforts that went into that. Back on the sanitation front, we have over 500 city blocks that have been sanitized as part of our aggressive outreach that continues. Both globally, we're trying to focus on the communities and the areas of the center city that are most impacted, as well as doing aggressive spot treatment. So we've asked all of our business owners and residences if they see human excrement or other waste that they think is ripe for transmission of communicable disease, that they either use their smartphone app or otherwise call that into environmental services, and then we have daily teams that come out there and try to make sure that that is appropriately cleaned up and disposed of. Over 60 hand washing stations, 4 restroom clusters that have been with security that have been opened up in the downtown community, and most really positive note, through our funding and efforts with the Downtown Partnership and their family reunification program, we've been able to successfully reunite over 230 individuals to date, both in and out of the San Diego region. We're able to get them successfully placed back with a family or close friend who are providing them a place of security and longevity. So we're really excited about that program. Lastly, we talked at this body last month about our rapid housing effort that is ongoing throughout the month of October. I want to thank all the agencies and providers that are here, both at the table and in the audience, for being a part of this effort. We've identified over 68 units so far to be able to get individuals quickly placed, and we know of over 19 individuals who have successfully already moved in, 8 of those into permanent supportive housing, 11 into rapid rehousing, and our efforts continue there. It's really been exciting to see people move into these units, but there's been some really good learning discussions on client choice and housing, acting with urgency and innovative strategies to better lease up some of these units. So these efforts are ongoing, and again, I want to appreciate everyone that's been a part of this effort today.
Great. Thank you. And to our secretary, Kearny, okay. Deacon Dorcas is not here. I'm assuming if he has anything important to say, Gordon, do you have anything?
I'd like to bring to the board's attention our discussion last month about advocacy. We had 3 individuals who expressed interest. 2 of them were, in a sense, naturally placed. Ken Sauter is currently working with the Downtown Coalition on what they are proposing, pretty much the TOT tax, I believe.
Actually, I'm working on with the San Diego Housing Federation.
Oh, okay. Well, I guess we're going to be really overloaded. We're going to be, I misunderstood your message then. We're basically going to be overloaded because Simone is also working with them on that board. But there are some other advocacy issues, and Greg Angel is very much interested in participating in this process, and so he will look at all of them. Right now there's several floating, so he'll try and keep those under context, or in context, or whatever you're going to do, Greg.
Try to be an air traffic control cop of sorts.
Right.
So, and there were a couple others around the board who I know expressed interest to me personally following some of the earlier conversations. So we'll work together to coalesce support and provide guidance for the issues that we think are going to provide the most critically needed resources.
We just have to be careful that we stay within the guidelines that we've talked about. So it's great to have people actively involved and perfectly situated to follow these. Thank you, Mr. Chair.
Okay. Mr. Workwright.
Thank you.
Okay.
I'll take the next item also.
The informational items is 5A.
Yes, thank you.
Go right into that.
One of the best pieces of news is that we have a new Chief Operating Officer, and I wanted to take just a moment to introduce Tamara Kohler. Most of you received a copy of the press release that went out. I've known Tamara for many years, and it just took us a while to woo her from a competing Seattle city. They were disappointed and so asked if we'd just keep our mouths shut for a while they tried to re-woo her. But fortunately, that didn't happen. Mr. Chair, if possible, I'd like to encourage Tamara to say a few words to us so you'd get to know a little bit about her.
I would like that. Yeah, I thought you could do a little more bragging first. I know you know some of the awards and things. She has distinguished herself, and she may be hesitant to share. She may be a little more modest than you might be.
Well, I'll summarize them.
Okay. Go ahead, Tamara.
I could just sit down, I guess, and we'll see what happens. I'm really honored to be here. I think that San Diego's really at a tipping point with the work that you're doing, and I hope that I bring to this talented team at the task force experience and leadership and understanding of national best practices, but also how to implement those kind of practices. They've had opportunities to implement things such as reworking a full HMIS system, so data is kind of my background, and I know how to be data informed and make sure that we put it in plain language and we can move targets. I'm very performance measure driven, and so those kind of things are important to me, and hope to bring those to the work that we do so we can show the good work and we're trending in the right directions. I think there's incredible opportunity as this board is moving in the right direction to have the kind of support of the task force to really align all of the work that we do. So I'm honored to be here and a part of your work, and I hope we're at that tipping point where it's good news and we're taking care of those individuals who need housing and will house them.
Tamara will be visiting with each of you as she comes around and looks at the practices that are occurring among the service providers. And we hope that we'll be able to bring to pass some of the things that we have hoped, making our data better so that we can make sure that our count numbers are correct and that we have the confidence to be able to make the decisions. I'm very happy to have Tamara. I did hire her on my staff in Utah several years ago. I forget how many years ago, Tamara, it's 1 or 2. And she was very, very good. And just in the conversations that we've had since she's been here, I know that we're going to make some big changes. For the record, as I was driving from Salt Lake to here to come and take this job, I made the call to Tamara. It's just taken her that long to get down. I guess I didn't put enough on the table. So.
I had some commitments in Seattle. I had to make sure that everyone who employs you, get your work done, right? So I worked till late Friday, drove down through the fires in California to start on Monday. So very committed to the work I do, an incredible opportunity in Seattle and the work that they were doing. And I bring their best wishes and their unhappiness with me that this is, but they're a great partner in this work, and we'll use them as a thought partner. And I bring all of my network of individuals who are working tirelessly in multiple cities and in regional efforts to help kind of educate and inform and link arms with you here. Thanks.
Thank you. Thank you, Mr.
Well,
Chairman.
welcome, Tamara. The HMIS and the data systems are extremely important. We've been talking about this, and this is one of the areas where I want to see some real improvements in short order. I'm not threatening, but and I know you're capable of doing that. I was glad to have you here. Your experience in both Salt Lake and Seattle is going to serve us well. So nice to have you here, and nice to have you part of the community. Okay, with that, we are going to go, that was 5A, we can go to 5B, Advancing and Redefining Communities for Emergency Management Conference. And Claudia Martosian?
Yes, they're Martosian.
Will be giving us the report. She's from the Veterans Emergency Management Evaluation Center.
Yes, we're part of, hello, thank you for having me. I really appreciate it to Megan and Mandy for including me here. I don't know if you can hear me.
Speak right into it.
All right, sorry. We are actually, I'm part of the VA, Veterans Affairs, and VMAC is a research center, and we are actually hosting a conference. And if you have this postcard, this is what we're talking about. So next slide is regarding ARC, our conference that's going to be held in San Diego. This is in collaboration with the National Healthcare Coalition, and we would really appreciate if you would consider participating, attending. We have an amazing host of 3-day, 1-day workshop and a 2-day conference panels, and all with the intention of coming together and sharing best practices and learning from what happens during emergencies, disasters, what are the best practices, and identifying them and sharing them. And this is an opportunity across the nation, folks coming together, coming from the healthcare perspective. But as we know, when there's a disaster happens, every community, every organization in the community is involved in some shape or form. So the coalitions across the healthcare system with the community organizations, agencies, is quite important. And us as a VA, as a federal agency, and the research that we've done at our center, it shows that the best practice is when we all come together. So, and this is unfortunately, given everything that's happening across the nation with Harvey, Irma, and Maria, and fires up in Northern California, everything that's been going on and the shootings in Vegas, this is really an opportunity to even learn more lessons from one another. So ARC is, again, happening in November, end of November 28th through 30th with National Healthcare Coalition. So if you want any more specific information, please let me know. And one of the things, the next slide please, is actually 3 slots on our agenda on ARC workshop. We're going to be talking in the morning, we're going to be talking to strengthen the safety net for people experiencing homelessness. And the homeless toolkit, this is the page, this is what I had actually passed around. I'm proud to say that we've been involved with HHS, HUD, and VA. We've constructed this toolkit, and it's been very well received. This is how to help the homeless individuals experiencing homelessness during disasters, because they're already vulnerable, and during disasters they're even more vulnerable. And there's a lot of issues that we're going to be discussing, and also we're basically showcasing how this toolkit can be used and how everyone can be benefiting with different sectors within the community. And Oregon case study also highlights, unfortunately, the ice storms that happened in Portland. 5 individuals died, and they were all homeless individuals, and 1 was an infant. So again, we're going to be talking about lessons learned from that experience. And then also the San Diego case study. We're going to be having presenters on the San Diego case study, San Diego fires and lessons learned. And unfortunately, this is also timely given what's happening in up north California. Up in north. I'm trying to speak fast, but so this is also we'll be talking and showcasing all the wonderful work that San Diego has done. And I live in San Diego, so I know I was impacted by the fire. So that we'd be talking about as well. So I hope I've enticed you. If you have any questions, my cards are out there. This toolkit has 3 sections, and this is kind of an infographic that we put together to kind of entice you to get, if you want. It's actually quite intense. The toolkit that we have is 95 pages, but anyway, it's something that hopefully that it has helped with the San Diego County Public Health. We've heard that they're actually using this toolkit with the HEPA as far as identifying where and how they can partner to best really come together in case of, it's a local emergency, how they can best address. So anyway, thank you, appreciate it. I don't want to take more time, but there's more slides, and that's basically HHS asked for HUD, SNAP's office, and VA. This is the front of the toolkit, basically. So thank you, appreciate it.
Thank you, Claudia. If anybody has any questions, she'll be around and available for you.
Yes.
Get some information from her. So that's item 5B. We're going to go on to item 5C, again, another informational item. This is about our landlord incentive programs. And, I know some of you are aware of this, but this is good stuff. Melissa Peterman's going to start, and Kelly Dufek. Kelly, you're going to start? Okay.
It's a combination presentation.
Okay. Whatever works.
Hi, good afternoon, everyone. Lower it down. Nationwide best practices in the area of landlord recruitment and engagement demonstrate that incentive programs are effective methods for decreasing barriers to
Kelly, you need to speak right into that microphone. Yeah.
For decreasing barriers to housing persons experiencing homelessness. Successful programs offer both financial and non-financial incentives to participating landlords and property owners. So I'm Kelly Duffick, and I am the Assistant Director of Housing and Community Development Services for the County of San Diego. We're part of the Health and Human Services Agency under the direction of Nick Mascione. Our housing department administers a number of entitlement programs: HOME, HOPWA, ESG, CDBG, as well as funding to develop affordable housing, as Chairman Roberts referenced earlier. We also service the Housing Authority for the County of San Diego. And the Housing Authority's largest programs are the Section 8 program and the Public Housing program. Our landlord incentive program is designed to serve homeless who are receiving housing subsidies through our department.
And I'm Melissa Petermans, and the Housing Commission's Landlord Incentive Program falls under the Homeless Housing Innovations Department, for which I oversee.
So according to an article recently published in the UT, the vacancy rate in San Diego is currently at 2.73%. The average rent is increased 7 points, viewing a 6-year trend.
I always like to make sure we're all on the same page whenever I'm giving a presentation on any of our landlord engagement, rapid rehousing, any of our housing first programs, just why we do this. And so I think it's worth using the Interagency Council on Homelessness quote that stable housing is the foundation on which people build their lives. And the Housing Commission's motto is we're about people, but I like to say that we're about housing people. That's what we do. And so just start every presentation off with that. And I think we're all acutely aware of the various issues that Kelly was mentioning that we as a region face in terms of housing affordability issues, as well as affordable housing, but also barriers to housing that clients themselves face, particularly low-income folks. And then when you tack on severe mental illness and other things like that, it really creates obstacles that I can't fathom having to manage while also looking for housing. So these are all the reasons why it's important for us to add that extra layer of assistance within our crisis response system to make sure that people have the access to resources to help find and move into housing.
So to help our programs house these harder to house individuals and families in the tight rental market, both the Housing Commission and the County of San Diego have created landlord incentive programs designed to recruit and retrain landlords. So how do we do this? We work together with our community partners, such as the Apartment Association. We network and we engage with property management companies at regional events. We've created a number of marketing tools, some of which we'll share with you today, including brochures and informational handouts. We've added quarterly marketing inserts into the 4,000 plus landlord check stubs that go out from our department. Quarterly, we put a stuffer in there to reach 4,000 landlords that we know that are already participating in our federal programs. And we include information on the 211 website. 211 is a great partner of ours, and they've been instrumental in the success of our program. And we utilize our own websites, social media, paid advertising spots, and our internal resources, such as County News and the Housing Commission's media department, amongst others.
I think the other thing I would add to what Kelly was saying in terms of things that the Housing Commission does to recruit and retain landlords, we partnered with an organization called Social Serve, and so they have a call center where they can do active landlord recruitment. So we're getting into the incentives and benefits portion of that, but it sort of ties into the recruitment efforts too. So on top of the staff that both of our agencies have that are doing active landlord engagement and recruitment, we have a website, in a sense. It's a free listing service for folks who do commit units. They list their units on that website. It's free, it's open to the public. Anyone can see the units that are available. And then their call center is available and is actively working almost 24 hours a day to recruit new landlords. So we're constantly giving them leads and they find leads. So in addition to having on the ground staff here in San Diego, we've got folks at our call center that are also working to recruit landlords for us, and it's been super successful. And then also a big recruitment tool for us are our homeless service providers. So one of the things that the Housing Commission can do and has done quite a bit through our initiative is our program is meant to sort of enhance the housing location services that are already available within the community. Most of the housing providers in San Diego are already doing housing location and landlord engagement. And so through our incentive program, then it gives another tool to those housing location staff to be able to use when talking to landlords. So let's say I'm Father Joe's or I'm VBSD and I found a landlord who wants to house someone and they've got rental assistance, they're ready to go, we get them moved in. All the Housing Commission needs is the paperwork, the lease, and we can pay the incentive to the landlord. So we're trying to expand and maximize all the efforts that are happening within the community as best as possible. So Housing Commission, we've got 4 full-time FTEs that are working on landlord recruitment and engagement. We do mediations and that sort of thing. We've got a host of financial benefits, many of which are the exact same as the counties, and I know Kelly's going to talk about that. And then a big thing for us is creating increased efficiencies in the lease-up process. And the best way that we've been able to do that is through the voucher program. So we can do pre-inspections of units. So as soon as a landlord knows that a unit is going to become available, they can let us know, and we'll do a pre-inspection, and the inspection stays good for 60 days. So that really helps to speed up the process. And so for VASH, we were able to decrease our time to lease up from 120 days to about 60 days since we launched our landlord program. And so there's just a number of different things that we were able to do.
We're seeing a lot of efficiencies through both of our programs. So what do these incentives look like? Examples of incentives are leasing incentives. Landlords may receive up to $500 for each unit newly leased in the county's jurisdiction to a person, and $250 thereafter. Up to 2 months rent security deposits, and up to $100 for utility assistance payments. We'll pay a holding fee to cover costs for keeping a unit vacant during the referral and leasing process, so that when we get a willing landlord, we don't lose that unit if we can't move fast enough to meet their deadline. We realize that these landlords have a choice of renting to anyone in the community, and when you have our clients, oftentimes they may not look as attractive to a landlord on the private market. Having these incentives is really key to keeping them engaged with us. We have a contingency fund. One of the things we heard when we met with the apartment association, and we said, what is it you would need to do to see in order to consider our clients versus the general public? And they said, we're concerned about loss. We're concerned about damage that may happen to the unit. So we have up to $5,000 available on top of the security deposit for any damage that one of these clients may do to a unit. And we pay for application expenses, things like credit reports and application costs that landlords may charge. And we have, as Melissa talked about, between 211 and our staff and Melissa's staff and their contractors, we've got dedicated staff members to provide excellence in customer service to these valued landlords. We know we can't house these people if we don't have landlords that are partnering with us to get the job done.
And of course, each of us are monitoring the outcomes of their programs so we can determine how effective they really are and make changes, program improvements along the way. And I know Housing Commission has made several. When we started Housing Our Heroes last year, we didn't get it right the first time, or the third or fourth time. So we've made multiple changes to the program throughout the way, and that has helped us to achieve the outcomes that I'm very proud of the team for accomplishing in terms of housing 1,000 veterans. We've recruited up, I think, almost 500 landlords, 45% of which are new to the commission. So, meaning we haven't ever rented with them before under Section 8 or any other program. We have only had of those 1,000 placements, we've only had 20 claims under the contingency fund. So we're seeing pretty good success for housing stability. I think having the service provider who's connected to that individual, along with the services that both the county and the Housing Commission can provide to help ensure that those folks stay housed, has really proved effective.
And since the inception of our landlord incentive program 17 months ago, we've been able to provide incentives to 185 landlords, 82 of which are first-time landlords ever dealing business with us. So we are attracting new landlords to our program, not just existing landlords over and over again, with a total value of almost $400,000. And since May 2017, through our VASH program, we've been able to house an additional 211 homeless veterans. We've got 581 VASH vouchers. They're all allotted with about 50 of them on the street right now with folks looking to lease up. We've got every BASH voucher issued, and we're leasing them up faster and faster with our incentive program. Since July 2016, our work with Project One for All, combined with our homeless incentive voucher program in the unincorporated area, has allowed us to house 445 of our most vulnerable homeless in the community.
Those are all the houses that we've gotten so far.
Yeah.
That's all right. This is an example of some of our county marketing that we've done. This is through County News Center.
He just moved into the new house he's renting. He's in an especially good mood because he's off the streets, all thanks to a program, Veterans Affairs Supportive Housing, called BASH.
BASH is a collaborative effort between the U.S. Department of Housing and Urban Development and the Department of Veterans Affairs. Not only is it going to help homeless, but for the veterans that served our country and now find themselves in a position where they need our help.
They provide rental assistance to homeless vets.
But more importantly, combines it with the social services that they need. That's good. Whether it's case management, drug and alcohol counseling, finance counseling, whatever it might be.
Randy is a Vietnam veteran.
Okay.
He was in the Army in Vietnam in 1970 and 71, and like now, played music.
We get to entertain the GIs that could not make it back to the USO shows, which was the guys on the front lines of the fire bases, so that's where we pretty much played.
This means Randy was traveling to the more dangerous areas. He remembers one especially disturbing show.
We could only get to about helicopter though. And while we were playing, about halfway through our show, a dog walked across the stage with a hand in his mouth. We just got there right after the firefight had finished, so they didn't have time to get in and help them. We finished our show and went out and finished.
And like so many who have experienced war, he suffers from PTSD.
Pretty much became homeless, without a job, without a car. It was so fast, I didn't even get comfortable so fast.
It's not just a one-time interaction with the client. It's the ongoing case management that provides that stability and allow people to get the benefit they deserve out of who they haven't gone before.
So the next program is counseling that you go to, which is cool. And they will monitor and watch you and help you with your more benefits that you have. They're offer you once you're in there. There's more counseling, more this, more that, more everything.
The only way the BASH program can work is with the help of landlords.
It's just one more opportunity you have to find a good viable tenant for your situation. It is kind of a rewarding thing. You feel like you're benefiting or helping somebody who's contributed. You know, for us,
to me, it's like a second chance. You know, my family's back together as a family. And it's just something else.
He's one of the perfect examples of what BASH was designed for. We get somebody off the street, provide them with the social services to get them back on track.
In the County News Center, I'm Suzanne Bartol.
Almost there.
I was just going to say, Mandy, you can just, that was a good one. You can just skip ours.
Randy Cardenas is doing.
Should we just go ahead and play it with them?
Sure.
About the dollars and the incentives and the bonuses, but putting that human face and that real story together with it is a really winning combination. Letting landlords know that there's a way to give back to their community, there's a way to make a difference, has really been the key to the success of our program. For the county, our program, our contact is 211, and landlords that are interested in participating in our program, that's the easiest way to get connected to it.
And we have our hotline, Housing First hotline still, the number, and as well as other information on how to contact us if you are a landlord or if you're a person experiencing homelessness.
Any questions?
Kelly, you might just clarify, this is not just the city of San Diego in the unincorporated areas. This includes other.
Right, we have our housing authority jurisdiction is includes all but 5 of the cities within the region, so all but 5 of the 18 cities. And so it is the bulk of the county, with the exception of the city of San Diego.
I'll get that list of 5 from you later, and I'll start yelling at those mayors, okay?
Chula Vista's ours, La Mesa, El Cajon, a lot of those cities we serve those areas as well.
Right, okay. Okay, question? Laura?
Very impressive, very touching, and I'm also very happy to hear that you're expanding to other target populations. Walter and I can certainly vouch that young people, transition-age youth, sometimes are very difficult to find apartments for as well, so I'm looking forward to learning from this and taking it to our young people as well.
Good. I'm sure that baby was going to bite right through his thumb and something, so I'm relieved that that didn't happen. Okay, anything else? Good report. Thank you, Melissa, Kelly, thank you. Okay, no action required on that. We have one more report. I'd like to get into that. This is regarding, I probably should have some more information coming on Hepatitis-A. We've got an update, first of all, from the county public health officer, but also from the cities of El Cajon and Chula Vista, which we always kind of think this is a San Diego thing, and I wanted to sort of broaden your perspective a little. I'm going to start with Dr. Sayon Pavan. I know I can't say that right. How can you pronounce somebody's name as 14 letters in their last name? Come on, Dr. T.
Hi, good afternoon, everyone. Thank you again for allowing us to give an update on the outbreak. Thank you, Supervisor. So I know that you've seen various versions of this presentation several times, so I just wanted to give you kind of the quick updates on what has happened really in the last month, the updated numbers, spend a little time and also make sure you're aware of the state of emergency and what that means. And then also, there's been a lot of questions about kind of water and how that's related to the outbreak. And Supervisor Roberts went and visited the CDC, and so we thank him for his continued leadership on this. And just wanted to share with you some communications we've had with the CDC. Next slide, please. And so
Could you try to talk right into that microphone?
Oh,
like
sorry.
It's a good friend.
Sorry. All right. So this is the slide that you've seen several times, just the updated version, showing where we are in terms of our overall cases of hepatitis-A, including our non-outbreak cases. But these are majority of those are outbreak. And you see that even in 2017, we're over 500 cases in total. We have 507 outbreak-related cases. And then, and you see that we're at the levels that we were at about 15, 20 years ago in the mid to late 90s. And so many of you were here in the mid to late 90s and remember, maybe you might not remember hepatitis being such a big deal, and that's because it wasn't affecting disproportionately these populations, which we in the room especially care about, right? So, but there was a lot of hepatitis A back then, before the vaccine was introduced. This next slide is just, you've seen this before, this is how we compare to other outbreaks across the country. I really wanted to highlight the Michigan case numbers. They publicly updated their case counts, and you see that they're pretty high and close. They've had a longer outbreak than us, but even though they've had a longer outbreak, they've actually looked to us for some technical assistance, and they're using our tools and a lot of our guidance in terms of handling their outbreak. But because they are also a person-to-person transmission outbreak, just like us, and also affecting homeless and drug-using individuals, you see that reflected in those vulnerable populations. Also a very high hospitalization and and a similar death rate. Next slide. Then these are the updated numbers. We have 507 confirmed or probable outbreak cases. Really similar hospitalization rate that you've seen before, similar death rate. Unfortunately, we're up to 19 deaths, still around 2/3 male, and still only one pediatric case that I talked about last time who was not vaccinated. None of our cases, our 570 cases, none of them have had the full 2-dose series of the vaccine. And many of them have had indications for them because they've had hepatitis, they were drug users, other CDC indications for them. And then this is just an update of the exposure types. You see that 33% are homeless and drug using, 16% are homeless only, 12% are illicit drug using only, 27% are neither, and 12% are unknown. Next slide. And then in these cases, you see that we continue to see a high comorbidity or co-infection rate of folks who have hepatitis B or C, and it's especially important that people who have other forms of liver, disease, chronic liver disease, get vaccinated and immunized for hepatitis A because they're more likely to have severe outcomes. We still have several non-outbreak cases that are coming through, and that's really related to that long incubation period, and most of these folks are travelers who go abroad, come back and get sick here. And then we have over 40 cases that are kind of suspect cases, kind of at any given time around 40 or more cases, and those are cases we're usually waiting on the CDC lab results to come back. We know they have hepatitis, we just want to make sure, confirm that it's related to the outbreak or not. We're bringing that process in-house, and we're doing that validation testing right now that'll make that, speed that up. And then again, as on the bottom, you see that there are linked cases with this particular outbreak strain in other parts of the country. What's not listed here is there are other hepatitis A cases and outbreaks. As I mentioned, in Michigan, there's also one in New York City among men having sex with men as well. Next slide. This is the epidemiology curve that you've seen before and just updated, and you see, and as mentioned, the last few weeks are not really reliable, so to speak, in terms of what it represents in terms of the volume of cases coming in now. We still get suspect cases coming in. We still think that the outbreak is kind of plateaued. The good news is we're not seeing increase in cases, and we're hoping it does not increase or does not spread into new populations like the men having sex with men populations that we see in New York City. And we want to, of course, bring that down. So we know that because of that long incubation period, sometimes it takes a little while to see the fruit of our collective labor, so to speak. So we'll keep monitoring this, and of course let you all know if we're starting to see a consistent downward trend. Next slide. These are new maps that we're starting to put on our website and update them weekly. And these are zip code level maps, and there's two maps. This one is a map of the hepatitis K outbreak related cases by zip code. And you see that some of the zip codes, particularly the ones kind of more east, are combined when they have less than 5,000 residents, just to help protect confidentiality. And these are recommendations that we abide by, that our privacy officer makes sure that we're complying with. So you'll see that we have cases around the county. This is, I know that the media often highlights the city of San Diego, but this is a county-wide issue, and this is why the declaration of emergency, that the local health emergency locally really applies to the whole county. So we do have cases all around, and you see not only where the cases are by zip code, but you also see on the left, some of the other data. So we have the 507 cases. We hit a milestone where we've done over 1,000 field events. These are vaccine clinics and homeless service providers and substance use treatment centers, field efforts, other field efforts like foot teams going out there to encampments, ravines, etc. And so many of this work in collaboration with you all. And then we've administered, over 76,000 vaccines county-wide, and that's in partnership with the medical systems, with the pharmacies, of course, with many of you and everything. So, and I do want to just also highlight that even though the zip codes are, that we have location data associated with some, but not all the cases, that location data does come with a lot of caveats. That is just the latest available location that we had for that individual, and that does not mean that that's where that individual was during, the whole time where they might have been infectious, or that doesn't even mean that that's where they were when they picked up the disease. So because especially with that long incubation period, it's really hard to tell, to have reliable data on exactly where they were when they picked up the disease. And it's only as good as our interview questions and how they answer the interview questions. But this does give us a good sense of, that the whole county is generally affected by hepatitis. Next slide. And this just shows the vaccine events that we've done across the county, and especially the field events. And you see that our field events are really targeted to where either we're aware of certain cases, we're aware of large populations of homeless or drug-using individuals, where there are homeless service providers, substance use treatment centers, and other sites. So we are really relying and working on with the cities because they know where their homeless individuals and drug-using individuals are better than us, frankly. So we ask them, tell us where your homeless people are or drug-using individuals are, and so that we can go out and offer vaccines to those individuals, and sometimes with their homeless outreach teams, their police teams as well. Next slide. So this is the three-pronged strategy you're well aware of: vaccinate, sanitize, and educate. Next slide. And this is these are the local recommendations. This is nothing new. Next slide. And this talks, I think I already talked to the amount of vaccines that we've given across the county. Next slide. And I just want to, sorry, I'm being brief because I know there's other great speakers after me. And then this is, in terms of our sanitation efforts, we are working across the county with a lot of the other jurisdictions. We had a sanitation forum a few Fridays ago where all the cities were invited to come and learn from the city of LA, the city of, and then us and what we're doing in the unincorporated space as well, and then share best practices and ask questions. So we have that, and now sanitation efforts are continuing to be done really by various cities. We also are continuing to go out there working with food service establishments and educate them when we're doing our routine inspections anyway, continuing to give out hygiene kits, and continuing to assess need for hand washing stations where there's no other access to adequate hand washing otherwise. Next slide. And this is just the map on 2-on-1, the interactive map if you wanted to see the locations of the hand washing stations. It also has some of the publicly available restrooms that are across the county and in areas where homeless individuals may be, if you wanted to let them know. Next slide. And we did also update our website. We did a pretty major update. You can go on our website and it should be hopefully easier to navigate. We're trying to listen to a lot of your constructive feedback and incorporate that. And we're continue to update that. Now we do have those maps as well on an update every Tuesdays. And we're updating our FAQs as well with a lot of these questions that we're hearing coming into us. Slide. So I did want to take a minute just to talk about the state of emergency that was declared last Friday. As you may or may not know, what that means in the state of emergency is that there's been a constrained vaccine supply, and that's what the state says. And so, the state gets publicly funded or federally funded vaccine, which we call 317 vaccine, and that we get for free to use, in our settings in public health centers for our field events, and also we distribute that to many of our partners, whether they're the emergency departments or whether they're community health clinics or others. And so, the state there's two manufacturers of the vaccine. One of them is currently does not have any availability of the vaccine, while the other one has availability, and that availability, there's a lot of demand for that availability because there's multiple outbreaks, as I mentioned. There's also an outbreak in Europe right now, also among men having sex with men. And so, there's a lot of demand, and there's only so much vaccine that they give away they provide to the CDC to distribute essentially for free that are federally funded. So this emergency proclamation, it's like there's a, okay. Yeah, this emergency proclamation allows the state to procure private vaccine as well, to use their, to allow the CDPH, the centers, the state Department of Public Health, to go out there and purchase private vaccine as well, and at a discounted price. And so they're doing that. They're getting access to more vaccine than they have in the past, which is good. And us being the largest outbreak in the country right now, we definitely are the priority for the state's vaccine. So that's next slide. And this is just talking about our continued work with many of the cities and the jurisdictions around the county. We have starting several weeks ago, probably months ago, we've been meeting with the individual jurisdictions, including some of the ones that you'll be hearing from, that had certain number of cases or more, that had locations of those cases associated with that jurisdiction, and talking and brainstorming about how we can continue to work together on that vaccine, sanitation, and education strategies. And so we're continuing to do that, and then we had a meeting several weeks ago at the end of September where our CAO called together all the city managers in one room to talk about the outbreak and how we can continue to collaborate. We're continuing to dialogue weekly with all of the cities, and we are continuing to partner. There's always opportunity for improvement, and we're looking also to you all and the cities to tell us, as individuals are moving around, we're hearing things like, due to some of the sanitation efforts that folks are moving around, and so we're trying to see where are these folks going. So if you're hearing about new areas where homeless individuals are going, let us know, so that way we can be nimble and adjust our vaccination strategy as such. And we've heard that from another regional task force meeting with HUD a couple weeks ago, some of that intel that's helpful for us to adjust our vaccination strategy. So we'll continue to meet with them, and as mentioned, we have the sanitation forum as well. So that's it on that. Before I get to questions, I did want to talk about the water for a little bit. So I know there's been a lot of questions about, how does the outbreak, what does it have to do with water? I think I've mentioned in the past that the water supply, the public water supply, the drinking water supply, is fine. That's treated, we're fine. There's no concern there. We know what we know, and we've been talking with the CDC for months now, and this issue has been brought up, and we actually got a letter from them yesterday. So hot off the press, I just want to read to you, some of that letter because of the concerns that I've been hearing. So they say, and it's addressed to my boss, Dr. Wooten. So CDC staff, I'm just going to read excerpts. CDC staff has provided the county epidemiology program with information and insight into the history of waterborne hepatitis-A virus in the United States and the futility of environmental sampling and outbreaks that are transmitted person to person. And so what that means is that, when we know that the outbreak is transmitted by close person-to-person contact, which is the most common way that it's transmitted in the U.S., really there's no benefit or value add from testing the water or the environment, because you already know how it's being transmitted. We just need to interrupt that transmission cycle by getting them access to hygiene and getting those at-risk people vaccinated. And then they say, just later in the letter, there is no evidence that either water or environmental sampling provides additional information for addressing person-to-person hepatitis-A virus transmission. Thus, investing in these activities can unnecessarily divert resources that are needed to contain the outbreak in proven and effective ways: vaccination, education, restrooms, and hand hygiene practices. Based on current public health knowledge and accepted practices, there is no change CDC would recommend from previous assistance given on this topic. CDC continues to recommend that the at-risk populations be vaccinated, educated about the outbreak, and have access to clean restrooms and hand washing facilities. So that's that, and I just wanted to make sure that you all heard, what we're hearing directly from our lead public health authority at the CDC. Thank you.
Thank you, Dr. Sam. Any board members?
Yes. Thank you, Mr. Chair. Thank you, Dr. Sam. And I think also in that letter, it states that there's been no cases in the past 30 years in the United States of waterborne transmission for hepatitis-A. 30 years. One of the things I want to point out is the cases. So sometimes we use it's a cumulative number. People think we have 507 people. It's not 507 people existing. In fact, probably with the tragedy of the 19 people who passed away, we have a number of people that are already built the immunity to hepatitis, and so the active cases like today is a much smaller number than. Yeah. Did you explain that?
Exactly. It's a very small fraction. So the infectious period or contagious period of someone with hepatitis-A is 2 weeks before they develop symptoms and then 1 week after. And that's what the CDC says. So, you know, by the time they come to see clinical care, get in the hospital, by the time we get notified about it, you know, usually they only have a few more days of infectious period or contagious period, right? So most of these individuals are well beyond the contagious period, and they're not active cases, so to speak. They might still have symptoms, they might still be feeling bad, because you can feel pretty bad and from hepatitis A or feel pretty ill for, you know, usually about a month, sometimes up to 6 months, but they're only contagious for, you know, up to around a week after. And that also brings up a great other thing that's happened in the last month, and that we have now a process for folks who are medically stable and discharged from the hospital, who are homeless and otherwise cannot self-isolate while they're still contagious. We've developed a process with our, you know, housing and urban, with our housing partners in the county to be able to give them temporary housing. So now we were working really closely with the hospitals, and if they have a person who's medically stable and ready to leave, but still in that contagious period, maybe for a day or two, and just needs a place to stay, so that they're not going back to the encampment and, you know, spreading and propagating the infection and the disease outbreak, we have a solution, and we are the first to have that solution in the country that I'm aware of. So another novel thing that we've done here.
Go ahead.
Maybe a question for the RTFH staff. With the point-in-time count being just 3 months away, and there's going to be a lot of contact with the homeless population, what's the thinking or strategy around preparing volunteers or resources to give to the homeless individuals?
For sure. Kat, would you like to comment on that? I'm not sure that we've really developed a strategy yet.
We do training videos for both counters and interviewers, and we added a slide in there just to, you know, where people can get as much information if they have concerns about hepatitis A. And we are planning at each site that we do count and interview sites having hand sanitizer wipes there for people to use. I guess the big thing we would say to people is if they are overly concerned about it, then they probably shouldn't volunteer. Or get the vaccination.
Volunteer.
Yeah.
From a, you know, transmissibility, infectious, right? Most folks, you know, who are not dealing really closely or routinely and on an ongoing basis or cleaning up after homeless or drug-using individuals are fine as long as they use proper hand washing, etc. So, you know, most of our volunteers, when I do the counts, you know, I don't know, maybe others are having different experiences, but I'm, you know, I might be shaking a hand, I might be saying hi, but, you know, this is, and I know I always discuss to you when I come here every month, this is a fecal oral disease, and that means that, you know, even if their hand has some contaminated, you know, is contaminated, and you have it on your hand, as long as at the end of the day you're washing your hands before you put anything in your mouth, you're fine. And so, you know, as long as we really emphasize that hand hygiene and give people the access to those, we should be fine for our volunteers.
Well, I think prior to the point in time count, we've got some work to do to
give some guidance. Right.
I think, yeah, it's going to be more than that. But Nancy?
Yeah, I was just going to say that a lot of the volunteers come from the county because y'all do such
the bulk
a great.
Of the volunteers
I know exactly.
Believe me,
so y'all do such a great job. It'd be great to educate people now.
Yeah.
Because we really need them.
Okay. Any other questions? We got 2 other speakers here that I want to get into action. Okay. With that, thank you, Dr. Sion. Very thorough, as usual. Keep those numbers going down. Okay. Graham Mitchell is the Assistant City Manager in El Cajon. He's going to help us and understand some of the things that are going on in El Cajon. Thank you.
Thank you, Mr. Chair and members of the board. I'd like to thank you for your service to our community, and I'm grateful for the opportunity to talk about what we're doing in the hinterlands. In fact, I walked in during Councilmember Ward's presentation, and I feel a little intimidated about the numbers that they've been able to accomplish. But remember, El Cajon is 7.4% the size of the city of San Diego, so keep that in perspective. I'm also going to try to use this time to squeeze in a little bit of the strategies that we're taking regarding homelessness in general, in addition to Hepatitis-A, if that's okay. So we can go to the next slide. So we've tried to take a very collaborative approach to this. This is not our area of expertise. Cities don't do this type of thing, so we've relied heavily on the county's partnership. They've been a great partner. They've been collaborative. They've been communicative. They've been very proactive with us. We're grateful for that partnership that we've had with the county. We also recognize that our resources are limited, and so we've tried to take the most effective strategies possible and focused our efforts and resources on those only, and have not done a lot of the other things that maybe some other cities may be doing, because we are trying to be as most efficient with our funds. We've also stepped up our communication effort, and I've actually been accused by some of our public of maybe bragging about what we're doing. And our intention is not to boast, but really to get information out to our community, to let them know that we are being proactive and helpful and helping the community understand what's going on. And lastly, we've tried to maintain some perspective. Sometimes when you read the media, you can almost get in this state of hysteria of this. So I just want to give 3 statistics. Last year there was 87 flu deaths in this county. There was 127 traffic fatalities, and there was 301 homicides. So we have a lot of things that a city balances every single day in addition to Hepatitis-A. And so we try to create some balance to that. And so when we have a lot of communication that we should stop everything, we have to remind ourselves and our community that there's a lot of other things happening in the city of El Cajon. Next slide. So what are we doing specifically? We're really focusing vaccinations on our high-risk population. We've gone out with county health officials with our homeless outreach team. They go out regularly. They know exactly where the folks are. They interact with them. We have a relationship with them, and so that's been very effective. We've done these county events that Dr. Sayano talked about at multiple locations, at our homeless service centers, at churches, at senior centers, trying to hit the most vulnerable population. We've also sent out letters to every restaurant, convenience store, market, gas station, liquor store, places that handle food, places that typically have public restrooms, and we've sent them information in Arabic, English, and Spanish talking about appropriate sanitation and hygiene in bathrooms, and also how to handle food more appropriately, and encouraging at least the food handlers to get vaccines. I saw every worker from a local Jack in the Box in line to get vaccines the other day, and so they're listening to what we're encouraging them to do, which is helpful to hear. We're also encouraging our service providers to receive vaccines as well, especially our public safety folks. Next slide. So really quickly, again, we value partnerships. We've been able to sort of parlay our relationships with others in our community to expand our resources. We've partnered with our downtown businesses who are handling all the sanitizing and hygiene needs in our downtown area and our downtown park. That's enabled the city to use our resources to hit additional areas. We're hitting our parks, we're hitting our bus stations, our trolley stations, and trying to augment some of our cleaning efforts throughout the community. And if we didn't have those business partnerships, the partnership with the county to install hand washing stations, we wouldn't be able to do that type of thing. Lastly, we've really, again, targeted our marketing. We have a designated website specifically for Hepatitis-A and what we're doing. We update it regularly, and we use our social media to get information out to our community. So let me switch topics really fast and talk about homelessness in our community. First, I want to say that we really are blessed to have organizations like this organization, like the East County Homeless Task Force, our homeless service providers like Crisis House and the East County Transitional Living Center, to give us some great ideas. And by no means are we in the forefront in terms of homeless programming in the United States. But I think for a typical suburban community, I think we are pushing the limits. And El Cajon has a city council that is willing to take a risk, and they're willing to push the limits and try. You can go to the next slide. So we have through Crisis House are paying for a housing navigator to serve the East County area. We're excited that we'll have somebody designated specifically in El Cajon and in East County to assist our homeless population. A housing navigator without resources is just a person with a computer. And so we have given that person $80,000 through Crisis House to provide housing assistance. And we are as flexible as we possibly can be. They can use it for pretty much anything that will get a homeless person into a house. There's very little strings attached to that money. We've also launched with the Chamber of Commerce our anti-panhandling campaign, Real Change, Not Spare Change. We're seeing some noticeable effects of that already, and we're excited to really push folks that want to help to places that can do more good than giving a dollar or two to somebody on the street corner. We also know that for some people, the loss or the separation of their pet is a deterrent from getting real help. And so we're creating a program with our animal shelter in El Cajon that we will take in pets of the homeless. We will board, we'll care for them for a certain amount of period. We'll get them vaccinated, we'll get them healthy, and while their owner gets healthy. And we're excited to unveil that program soon. There are far more complications than you would think, and the state of California is one of the complications. So we have to get licensing to be a vet, in other words. So we're working out some workarounds to make that happen. We've also partnered with the East County Homeless Task Force, and we've helped them launch a really cool application on a phone. Doesn't require a smartphone, it's text phone technology, so it connects people that may have a phone that they received to be able to connect with services, which is exciting. Next slide, almost done. We are really excited about funding with the Salvation Army a reunification program. Not as much as Councilmember Ward talked about in the city of San Diego, but we just launched this program. In fact, we don't even have agreements with the Salvation Army. We're kind of operating on good faith that we're going to pay them. But they've actually relocated 7 individuals and families back to their homes. And what a great program. And for the cost, it's so cost effective. And so if I could advocate to other cities, this is a program that's easy to get behind. It costs so little and can do so much good. We continue to use our homeless outreach team as advocates for the homeless, and we're looking at ways to actually expand that so more of our police department gets a chance to be with them, so they get to know a greater number of our population, or our police department gets to know the homeless population and build some trust there. We want to be very data driven in our decision making because we have so limited resources. Every policy direction has to be proven effective. So we're actually working with San Diego State's Public Affairs, our Public Administration program. We're going to develop a semester-long program where they're going to do some additional research and collaborate with our local service providers to get some data that maybe we're not collecting now, and we can show that the programs that we're implementing are doing good. Ninth, we really want to be a partner, but more than a partner, we want to be a leader in this area. The City Council of El Cajon has stepped up and said, at least in East County, we want to be perceived as the agency where people can look to for solutions. And we want to push the envelope and try some new things and be that model for a suburban community. And lastly, we're working with some developer communities and some homeless advocacy groups on converting some of our less effective motels into some short-term temporary housing for the homeless. So those are some of the things that we're doing. That concludes my comments, and I can answer any questions if you have any.
Graham, I want to thank you for that presentation. I really appreciate you being here. And, you know, if there's any way that we can continue to, first of all, I also want to pass on to your leadership, both your elected leadership and your city administration, my gratitude for you all stepping up and doing what you can do to try and expand your role and your functions within homeless services. Sometimes we live in our own respective cities and jurisdictions and bubbles, and what we hear from particularly communities in the East Village is a narrative that, you know, other cities are saying, we'll just hop on the trolley and go down to the East Village because that's where all the services are, and it's just a bit obviously taxing for us to try and manage regionally. So I really appreciate the efforts by our sister cities across the county for their, whether it's, you know, managing 50 people or 100 people or your own reunification program, just something is going to cumulatively add up to be a big difference for the entire county. And I'll just leave this kind of open-ended, but I like where this is going. And if there's any way that we can find better collaboration or some kind of more regular communication between all of our cities' administrations about best practices and coordinated efforts, I think that we're starting to head in the right direction, but I appreciate the momentum that you're leading in East County.
Thank you. There's nothing else. Thank you so much.
First, don't leave the mic yet. Mr. Walker.
Graham, thank you very much for this report. You said that you're not a leader, but you're doing all of the right things. As I came out and met with you, very impressive. And Councilman Ward, Member Ward, we will continue to work together to band all of these communities together, because these are best practices, the things that you are doing into the prevention area. So great job. Thank you.
Thank you.
Graham, go ahead.
Graham, I want to, hi,
you.
by the way, good to see you. El Cajon stole Graham away from Escondido not too long ago. So I want to similarly compliment the good work that you're doing, the leadership that you're doing, and mention that this board and this organization has the opportunity to share these best practices and help other cities who have similar interests and desires to do the good work that you're doing to understand how to do it, and to connect 18 different jurisdictions into a cohesive strategy. So well done, and I'm excited about what we as a group can do to regionalize these efforts.
Great.
And that actually, Greg, you're thinking along the same lines. There were two things that jumped out at me that you mentioned that I thought maybe could be regionalized to a greater extent. One was a reunification, which we're heavily involved with, and the other is the navigator, where you're trying to place people. And I think our hope is that we get one consistent system that we can really use across the whole county and are able to place those people. But you're working with us would be really appreciated. Give Mayor Wells my best and let him know that we're very appreciative of the efforts that are going on in El Cajon.
I will do that. Thank you.
Thank you. Okay, Nancy, I forgot you.
Ron.
I know, I'm sorry. I apologize
We'll talk later.
profusely. How could I do that? But go ahead.
We'll talk later. Thank you. I just wanted to take a couple minutes to make a couple of announcements from the Funders Together to End Homelessness. We just made a grant to the Regional Task Force for the Homeless. As you know, having the staff based on the organizational assessment that was completed, we need to have the COO, as we just were introduced to, and really excited to have her on board, as well as a director of development that can be doing the fundraising that we need to make this actually go and have some resources to go forward. The Regional Task Force approved $425,000 over 2 years to cover the cost of those two positions. So we're really looking forward to working with them and really excited to do that. So I thank my partners in doing this, with Karen, Vicki, and Michael, if he's here, and everybody, the public people that are on board with Housing Commission in the county that are also a part of this discussion. So thank you. And then second is that we also commissioned an assessment of different communities in the country to see what is going on and what they're doing to be successful in ending their homelessness, but also in what maybe has made them decline in their success. And we, oh gosh, am I going to remember all four? San Jose, or Santa Clara County, Seattle, Philadelphia, and Houston. And we were really fortunate to get Houston right when the hurricane hit, so it's a little bit, I know, right? So we didn't actually get to have our people go out there, but they did talk to them on the phone, so we really thank them for that. But we wanted to get into what their secret sauce was. We didn't want to just get the structure and who was at the table, but what was it that they felt like in their communities made it successful. And so we're excited to let you know that we've gotten those results in. We are scheduling some public forums to be able to release those results, but we also want to come back at the next meeting in November and provide those results to this group as well. Just wanted to let you know it's coming. So maybe Ron won't forget me next time.
You bring another $400,000, I won't forget you.
It wasn't just me. I have to really say it is the group of us that work together and pull the funds. So I have to.
No, thank you, Nancy, and all of you who helped pull this together. We're going to have been talking about this for some time, and it's good to see that happening. But I'm looking forward to your report too, and we will have that on the agenda for sure, because I think we can learn from other areas and see what we might apply. And you know, one size doesn't fit all. Every community is different, so we got to keep that in mind. But I think we can learn and hopefully short circuit the things that don't work. But thank you. Okay, with that, I think that everything. I don't have any additional speakers requests. I don't have any other comments from board members, and I'm going to declare our meeting adjourned. We'll reconvene next month on Thursday, November 16th. Put it on your calendars and look forward to it.